All right, we're here live from HCIC, the Healthcare Interactive Conference in Las Vegas, Nevada. And I'm sitting down, delighted to sit down with someone that I've seen on stage a number of times, Douwe Bergsma from Piedmont. And I'm really happy that you're here today to have a conversation.
Yeah, happy to be here and happy to be in the podcast.
Yeah, that's great. Well, before we get started, share a little bit about your background and where you came from and what you're doing today.
Yeah, well, as you said, I started with Piedmont a little 5.5 years ago, like a full month before COVID, so that was an interesting journey. Before that, I was the Chief Marketing Officer of Georgia-Pacific, the largest paper manufacturer in the US, and before that I was 19 years with Procter Gamble, working on a range of brands. And then outside of those two organizations, I'm very active in the industry through the ANA, Cannes Lions, and some other activities I've done to advance the industry in the areas of marketing and brand building.
And I love that sort of that diverse background, because really in healthcare, we know there are many people that come into healthcare and they've been here for a very long time. They have a specific focus that may not allow them to understand how other industries operate. And one thing that I think I've seen over the last 5.5 years at Piedmont is the way you've embraced experience and patient experience particularly. I think you have a unique point of view on that. Share with us a little bit about that.
Yeah, so from a patient experience, it starts before they even know they have a need.
Yeah.
So in our case, we look at how do you build a brand, how do you make sure they know you and they like you. And at one point the experience turns in how to make sure they choose you, and then they have chosen you, how do you make sure they love you? By making sure that the satisfaction with the engagements are as high as they can be. Now, from a brand growth perspective, you have little impact on the true clinical part of the experience, but you have a lot of impact on the non-clinical part, physical and mostly on the digital side. And we try to connect all of those. Give you an example, not too long ago, about a year and a half ago, we made sure that patient experience, brand building and brand performance, as well as insights and analytics, all now fall under one roof. So whether you do your patient surveys, or you do the Epic MyChart, or the CRM with Salesforce, or the TV campaign, it's all housed in the brand growth organization to make it as seamless as possible. Now, that sounds great, because it comes with a lot of complexity and challenges,
sure it does.
Even when it's under one roof.
Yeah, well, let's lean in a little bit on that, because that is very complex. Having mapped patient experiences, having understand, there are sometimes that developing that seamless experience can be very challenging, particularly if the consumer today bounces around multiple different ways and they enter into your organization in multiple different ways.
So two things I typically focus on, and that's what we did at Piedmont. One is, what are the objectives and what are the metrics, and put it in a scorecard and hold everybody accountable to those aligned metrics and what the results should be. So that's one. And for brand growth and brand building, we did that, awareness, favorability. Then we did it for the brand performance, its office visits and operating income. We weren't as clear on the patient experience, but now we have two key metrics there as well. One is around satisfaction, the other one is about digital tool utilization. But also bring those together, how do those 6 metrics hang together and have the same group of people be responsible for all 6, as well as the other departments, whether it's physician enterprise, the patient connection center, finance buy-in, our CEO, to make sure that we have these metrics on one scorecard, and hopefully they move in tandem. The early results show that they do, but ask me again next year.
Yeah, well, exactly. But having a scorecard is really powerful, because it can do so many things. First of all, it can allow you to show how you're performing, what your ROI is, so to speak. That term is thrown around a lot, but you can see what your return is, return on value that you're doing. But I think there's also an aspect of where you can start to understand where you prioritize your efforts as well, right?
Exactly. So if you have a clear understanding of the objectives and how you're going to measure it, you can then relate all of your activities to those metrics. And then you can decide, this effort, this investment, this technology platform that we're doing, to what extent is that contributing to this satisfaction metric? or to this tool adoption metric. And if you conclude like actually there's zero correlation or zero causality, sometimes there's correlation and causality, and say, well, why are we doing it? And people would say, oh, we need to be differentiated. Like, well, differentiated without a result is basically not differentiation, because differentiation is how you are distinctive in a measurable and relevant way, not in, hey, we have something cool and different. And so that's what we started doing. With the metrics in hand, we started assessing everything we did and said, does this contribute to the metric? Sometimes we decided, no, but we have a belief we can do it, let's step it up, let's change it. Sometimes we decided, no, we need to stop doing it. The nice outcome of that is you free up budget in those things that did not drive the value that you hope for, and you can redirect that budget into things that do drive value.
You know, one thing I know, having been 15 years in healthcare marketing, we do sometimes over-invest on what it could be, what the possible could be, what the future could be. But we have to be pragmatic, and we live particularly in a time where our budgets are not, healthcare in itself is not very huge budgets, but we're living in a very cost-constrained environment too. So, how do you work with organizations internally, with your organization internally on this, to show the metrics and show where the value is, and sometimes say no because
we say no a lot because of the metrics, and you worked in healthcare 3 times longer than I did, and there's a lot of stronghold beliefs around some investments, like we have to do this, fill in the blank, sponsorships, billboards, separate app, wayfinding, all of these things. And if you do them, great. If you do them and measure them, even better. And if you then make decisions on the outcomes of those measurements, positive or negative, and make hard calls, that makes the most sense. We all know we have we work with a highly intelligent set of colleagues. I would argue that most of the doctors are smarter than I am, except in the area that I am smart, which is marketing. And so when they come with a request like, oh, nobody knows XYZ, we need a billboard on highway. Sometimes they even say which exit the billboard needs to be. And it's like, well, the data shows actually your awareness is higher than you think it is. The data also shows your office visits and the utilization of your capacity is pretty high. And the data also shows that doing a billboard is not going to make any difference in this specific case. And then with all the data, they're like, okay, let's reframe this to talk about what is it you want to achieve? What is your objective? Is it higher awareness? And let's then talk about how we drive awareness rather than the tactic you're in. Dave this morning had a great keynote speak about that whole mindset difference, which really resonated with me and others in the audience.
Right, absolutely. And we so often other parts of the organization that don't understand the nuance, the science of marketing.
Yes.
Right? They do come to you as like, well, I want this tactic, I want this tactic, I want this tactic, because that's what they, that's their myopic view of this. What you're describing is like almost an evidence-based marketing approach.
Yes, it is, and it's interesting because most of the people you have conversations with are very data-driven, are very science-based. They would never approach a clinical process or a patient without that science. And then, the topic switches to marketing, and all of a sudden it's like, well, I really want to do XYZ based on my long-term knowledge or my long-term opinion. And it's like, I hope you don't treat patients with that same level of data understanding, because you literally have an opinion here while you have, 10 years of studying and science-based approaches and thinking when you do your clinical treatments. And that sometimes resonates, like, wait a minute, are you telling me that marketing is as science-based as, my craft in the clinical space? It said, well, maybe not as sophisticated, but it's way more developed than any of them actually think. And some of that is all marketing itself, because we've never been as evidence-based as we are today, nor have we communicated that.
Yeah, exactly. The communication. Oftentimes marketers are the worst communicators too.
Yeah, it's right? Like doctors being the worst patients, right?
Exactly. It feels the same way. I'm wondering, I want to pivot a little bit too. Sure. It's also very critical for us to understand patient expectations and patient experience. And I know you focus a lot, your organization, your team, focuses a lot on understanding the patient and how they're evolving. What are ways that you're using the tools that you have to also look at, maybe the patients are now starting to use generative AI now, right, to access your care, those sorts of things?
Yeah, so two answers to that. First and foremost, we recently started integrating all of our patient insights and knowledge. So now my organization oversees the things we do for patient surveys in the hospitals and in the clinics that used to sit in a separate department. We have MMM, marketing mix modeling, that we introduced to Piedmont. We built it over 2 to 3 years. We have brand tracking, and we're all bringing that together and trying to connect the dots to basically look at all of the patient understanding that is out there to make it more integrated, and at the same time report it in a more actionable way to the organization as a whole. The second part, on the generative part, I don't know what I don't know. But I do know that this is not the first time in my career that I find myself here. Keep in mind, when I started, there was no internet, there was no social, there was no mobile, there was no Web3, and definitely not AI or generative AI. But as you go through these ages and these changes, the two things I do know is that first and foremost, you need to be a student of these changes, keep a close look and experiment a lot. And then the key with experiment is measurements and pivot and change when the measurements indicate it. Sometimes we hang on to stuff for too long. We say, oh, we did this, and then 5 years later, oh, why are we still doing this? So do the experimentation, follow up, and then change. So that's one thing. And the other thing is literally also just trying to understand what the priorities are. So I'm kind of reliving the days of mobile and social, as well as the internet, where, let's say, consultants, colleagues, agencies, tech platforms, tech companies come, we got this cool new thing, this gadget. It might solve the problems that you have, but more often it doesn't. So we're trying to flip the script and say, we will tell you what our priorities are. I have objectives. Some of them I'm meeting and exceeding, some of them I'm not even close. How can AI help me to close those gaps? How can I focus on things that help thousands of patients rather than 2? How can I help do things that potentially can have the patient find the right doctor at the right place at the right location more easily than trying to save a few bucks on a copywriter? But guess what? I'm getting most of the, hey, PowerPoint is dead, hey, copywriting is cheaper. And I was looking at that, it's like, yes, that is an easy saving, but is it really my priority? Am I really serving more patients better than before? So that's what we're doing, experimentation and setting clear priorities, and then go to the vendors and says, this is my problem, this is how I make more lives of more patients better. Can you help me with that? Right. And interesting enough, most vendors love that.
Yes, they love when you bring the strategy to them.
Yes, they're like, bring it on.
Yeah.
Like, can we work on this together? I've never had a vendor, no, I want you to focus on this PowerPoint replacement, or this copywriting tool, or this, how do you make a 60-second ad cheaply down to a 15 and a 30-second. They're like, no, I want to solve the big problems with you. Sometimes they just don't know it, and often they just need to go with the low-hanging fruit. You know, they have a board too, you know, and they have objectives too, so I understand that part.
Yeah, absolutely. Well, I'm going to ask you one question. I know you don't like to predict where things are headed, but I'm just curious, what trends are you paying attention to? What are things that you're looking at that potentially could change our industry, our discipline?
There's, what I'm looking at without knowing where it's going to is how will your healthcare system or your service line and or your practices and your physicians all the way down show up when people are looking for care in the future. So today we have some understanding on how search works and how the sites works, etc. In a world with Gen AI, with so many players, you know, find the best doctor in Atlanta that can help me with this headache that I just got after I bumped my head. I don't know if Piedmont will show up best in ChatGPT or Perplexity or any of these other things, so that's one. that I'm really looking at. And the other thing is how will generative AI help patients to find the right care at the right place, at the right time, at the right place, at the right location. And that's going to change. I just don't know how. So those are the two things I'm expecting to change. But hey, if you would have asked me 10 years ago or 15 years ago what is key, I would probably say we need to have a higher presence on MySpace so that they can use their BlackBerry to get there, and none of these assets even exist anymore. Right. So it is very hard to predict in an unpredictable world. But those are the two things I'm watching closely.
I love it. Well, Douwe, this has been a really great conversation. I appreciate you sitting down for a few minutes.
Yeah,
talking.
It was fun.
A big fan of you, and I'm so glad we had a fan.
I'm a fan too. Keep up the good work. I'm looking forward to the next one.